Now, I did get some help on this video from some seasoned veterans in the Western University Internal Medicine training program. All of these individuals have had good experiences running teams, and they all rate themselves extremely highly as team leaders. So, it's interesting to see what they think. The first question I asked them was, what do you think is the most important thing that you did that allowed you to be successful when running an inpatient medical team? And then, why did that work for you? So there were a variety of responses that I got. One person, and I think that a number of people commented on this, is about preparation. You need to feel like you've done your homework. So, I was prepared. I read Harrison's religiously in my first year. And really, when I encountered clinical scenarios, I felt like I really had been there before, and I was able to offer guidance to the team and it wasn't anecdotal. It was actually evidence-based, based on good preparation. A number of them commented on early rounding. Helping to make the plans for new patients and set up, the paperwork that needs to be done before actually meeting with the juniors or the consultant staff, just in order to become organized and so that you don't forget investigations and all the things that are important to care for the patients. Couple of comments on organization. One was the idea of preparing cue cards for each patient with active issues and to-do lists. You'll see another comment about cue cards versus electronic records that are updated by yourself as well as the rest of the team. But really, preparation before rounds was really highlighted as an important thing by most of the respondents. A particularly long-winded resident wrote the following: maximizing efficiency. I do this in two main ways: organization and an early start. Organization-wise, I maintain an electronic list that I would update and distribute to the whole team. When an SMR keeps patient cards that help them, but not the rest of the residents, that's like hoarding knowledge, and it duplicates work for the juniors. So that having this electronic list that's accessible to everybody gives all the juniors a to-do list for the patient in the form of active issues and plans. When it's time to discharge a patient, you have a succinct list of issues that are active and resolved, as well as active and still need resolution after patient discharge. The key to maintaining this is that before the rest of the team starts their day, you need to get in there. And this resident says, I start at 6 a.m. And I actually am attending the patient bedsides to review overnight admissions, update the list with the new patients, and renewing investigations that are pending, so that I can get that onto that list so that all the juniors have, the same list of to-dos. By the time I get to morning handover with the overnight resident and the daytime team, and we're hearing about the patients, I have already met the patients and managed them, and that lets me do some teaching right from the get-go. Some residents review the list and admissions from home, but I do it in-house because then I can act on things that need emergent action, like getting central access. By the time the day starts and the rest of the team have come in, I've already met the new patients, as well as the patients being discharged, and I can tell the allied healthcare team who's going home, and then the medication reconciliations can be done quickly and efficiently. And then the final comment that this resident makes is that at 6 a.m., every patient is in their room, none of them are off the floor up for tests, no charts are missing, and there's always computers to use. So some really good comments there. Another comment was making sure that the handover list is updated with tasks for the juniors to do is important. Making sure that people are focused during handover and that they stick to the active issues. Handover talking for 2+ hours is useless. Telling juniors to make sure their notes are concise and include active issues and plans. A note that's too long is useless because no one will read it. I don't need them to add blood work to their notes. The blood work is in the computer already. I don't want people to drone on and on about how the patient doesn't like the food. It makes handover longer and we zone out. Sometimes it's important to remind them at the beginning of the handover that if you have 30 patients on a list to be seen and it takes 90 seconds per patient, you're already going to be sitting there for 45 minutes. The handover time is not a time to socialize. Socializing is for outside of work. On the point of making sure that your juniors deliver nice, concise comments, when I, as a consultant staff, have juniors that are being a bit long-winded and perhaps tangential, I tell them that there are really only 4 sentences that I want to hear them say. The first sentence is why that patient came to hospital. The second sentence is why the patient is still in hospital, i.e. they're still on oxygen for their pneumonia. I want to know from the junior house staff, when do you think that patient is going home? And then finally, what are you doing for that patient today to get them ready to go home? So those are the 4 things that really need to be said in a handover time. And if you stick to those 4 things, you can get done fairly quickly. So those are the comments. I hope this video is helpful to you. I hope it gives you a few things to think about. I guess I would summarize what I've heard certainly from the senior residents at Western University is, come in early, be prepared, make a really good electronic list with to-dos on it, be concise, and you will be successful. But you do have to be a bit of a general. You have to be, a bit of a political party leader. You might have to be a bit of a press gang sergeant, but you absolutely can be successful. And the skills that you learn leading an inpatient medical team are things that will allow you to transition into being an extremely successful consultant physician working in your own practice environment. So I hope this is helpful. Go off and have a wonderful day and do a great job leading your teams.